Welcome to the Endpoints podcast, presented by the ALS Therapy Development Institute. I'm Jonathan Gang. ALS TDI's ALS Research Collaborative, or ARC, is a global initiative that partners with people with ALS to gather data about the disease to help us better understand the underlying biology of ALS and accelerate the discovery of treatments. Recently, ALS TDI announced a partnership with Unite Genomics, a healthcare data analytics company that will allow us to integrate a new data source into the program, electronic health records, or EHRs. Today, on Endpoints, we're joined by Unite Genomics CEO Tanner Dagdelen to tell us more about what this collaboration entails, what researchers can learn from EHR data, and what this means for present and future ARC participants. Okay, and today on Endpoints, we are joined by Tanner Dagdelen, the CEO of Unite Genomics. So first off, just thank you for joining us today, Tanner.
Thanks for having me. I'm excited to be here and talk with you.
Awesome. And just to start off, can you tell me a little bit about Unite Genomics and what it is that you guys do?
Yeah, so we actually are a spin out from a computer science research lab at the University of California, Berkeley. The premise for starting the company, the reason why we did it was we saw an opportunity to apply some of our computer science skills to this world of healthcare data in a way that would accelerate the development of new treatments and cures. There's a tremendous amount of data being generated in electronic health records and patient-reported information and genomic data, and it wasn't really being used. Still today, we have a long way to go in terms of using that data to accelerate the development of new treatments. And meanwhile, we had these new technologies and capabilities in analyzing this large-scale data to accelerate that process. And we thought, okay, well, if nobody else is doing it right now, it needs to happen. So let's go do it. And that was the impetus behind the company in the first place. Fast forward to today, we're focused on enabling those organizations that are conducting the preeminent research happening right now with the tools that we've developed so that they can capture and mobilize really powerful data. So in this case, we're excited to work with ALS TDI because we've been in the ALS space for the past 2.5 years as well, and have seen firsthand some of the challenges around making use of the data to accelerate treatment development. And ALS TDI is really leading the charge in terms of developing new treatments and looking at data in new ways to make that happen. We're excited to be part of the story.
So can you say a little bit about why it's important to connect researchers with these electronic health records, and maybe also, why do we need kind of an intermediary to provide them? Like, why can't they just go and access them themselves? What's stopping them from doing it?
Yeah, so there's a couple different aspects of it. I think we can break them down into some logistical challenges and then some access barriers. So right now, as a researcher, I don't have any access to any of the electronic health record systems for privacy reasons. I can't just go in and pull records from patients that would have no idea that I just pulled their records. Obviously, as a society, we don't want that. So thankfully, that's in place. But the system is set up right now in a way that makes it hard, even for participants who want to share their records, to do so easily. Historically, we've had to go through very manual processes that often depend on paper. And believe it or not, the system still runs on fax machines today. I know it's crazy to believe, but that's still how it happens today. And it's not uncommon for a provider to mail a CD of your medical record data to somebody else who has the rights to or authorization to access it. But that entire system has been turned on its head in the last couple of years. There were some regulations that were passed in actually 2016 that said, as a patient, I should have access to my healthcare data in digital form, just like I have access to my banking data and everything else. And I should be able to provide a third-party authorization to access those records as well, so that it's very easy to share my data with those people that need it in order to help me do something I want to do, whether it's research or get additional healthcare or something like that. And so those regulations really didn't kick in until recently. In the regulations were there, but the hospitals and healthcare providers weren't compliant with the regulations because the penalties didn't kick in until 2022. So in 2022, of course, compliance amongst the hospitals and health systems went way up. Before we were looking at like 300 to 1,000 different providers were in compliance across the entirety of the US. And in 2022, that went up to 26,000 providers were compliant. And that covers basically the entirety of the US population. Now that that's possible, we can get rid of the fax machines, we can get rid of the CDs being sent in the mail and do everything electronically. That's kind of where we sit, is we built the technologies for sitting in between research use cases and the hospitals and health systems that are now in compliance with those regulations and provide access to their patients and third parties, which is us, to access and help those patients share their data more easily.
Got it. And then can you just, tell us a little bit about how you first connected with ALS TDI?
Yeah. So as I mentioned before, we've been in the ALS community for a little over 2 years, working directly with lots of awesome members of the community. About a year ago, or actually maybe a year and a half ago at this point, we started an ALS advisory board. And this was a group of people living with ALS and some caregivers as well, who we'd meet with. Initially, it started on a bi-weekly basis. Every 2 weeks, we'd have a meeting to get feedback and have them help us figure out what the North Star needs to be so that we can make sure we're contributing to the community in the best way. Now it's monthly. But I met Fernando through an introduction from one of the members of our ALS advisory board, who happened to know Fernando as well as ALS TDI more generally, and thought, hey, they should talk. And when I spoke with Fernando back then, it was clear he had a very big vision for the impact that ALS TDI can have and the different components he needs to pull together to make it happen. And he had been looking for adding this ability to the research efforts that were ongoing for a while, but until recently it wasn't possible. So it was kind of a right time, right place sort of thing.
Got it. And so for participants in our natural history study, the ALS Research Collaborative, what is this going to mean for them? How does this sort of affect the individual participants?
Great question. This is one of the things that we're most excited about. Up until now, conducting observational research and natural history research, similar to ARC, requires a lot of questionnaires, a lot of time filling out surveys about medications and what dosage you were on and when you were on it, when you went off it, and all of that. So it's tough even for me to recall what medications I've taken in the last few months, last year, let alone my entire health history, especially in a disease area as complex as ALS, where there's many different, we may try many different medications over the course of trying to find something that works. And it's a fairly large burden for those who participate. And on top of that, a lot of research studies are asking the exact same questions. So if I want to participate in multiple studies, I have to do the same thing over and over and over again. So we learned a lot of this from engaging with our ALS advisory board early on, and have built built that into our system so that we can alleviate some of that burden. So, what does it mean as a participant? It means that a lot of the information, which historically the only way for you to provide that to ALS TDI would have been through a questionnaire or a survey. Now you can seamlessly share it with them just by connecting your basically signing into your patient portal using our system and retrieving that information, sharing it with ALS TDI. It's very seamless. It takes about 30 seconds to do. It's just as easy as signing into your patient portal. That a little window pops up that says Unite wants to share certain information from your records. Are you okay with that? And if you click yes, it gives us the credentials that allow us to retrieve the data from the system and share it with ALS TDI.
Awesome. And so are health records from all healthcare providers available, or are there certain ones that will work with your?
Another great question. So right now we work with the two largest electronic health record vendors in the country. Those are Epic and Cerner. But what that means for participants is that because as a general community member, I don't normally know which kind of electronic health record system my provider or hospital is using. But practically speaking, all the major hospitals and health systems and major clinics are typically using either Epic or Cerner as their electronic health record. And therefore, essentially all the major hospitals and health systems that may have your data, you'll be able to connect with and share into the ARC portal if you choose. The smaller clinics, maybe primary care physician that isn't even using electronic health records, obviously we won't be able to retrieve those records and share them with the research effort. But most of the major ones we cover. As it stands, we're integrated with 2,600, a little over 2,600 different hospitals and health systems across the U.S. And that means that we can retrieve data for approximately 75 to 80% of people in the US. So you should have some data that you can share, records that you can share into the research effort. And for most of the people that have already used our platform, they've been able to find most, if not all, of their records recently. A year ago, that was not the case, right? Compliance was low, but nowadays it's much better.
Got it. And can participants do they have any control over what kinds of data are shared?
Yes. So that's all part of the authorization process when so as a participant, if I go in to connect, let's say, University of Colorado Health, for example, the pop-up window that comes up that says Unite wants to access certain parts of your record for the purposes of sharing, you have the option to uncheck a bunch of checkboxes associated with different parts of your record. So if there are aspects of the record that you don't want to share or don't need to share, you can uncheck those boxes, and those won't get retrieved by us or shared with the ALS TDI study at all.
And what sort of protections are in place to make sure that this data all remains private?
Yeah, it's a really great question. And I'll add one more, which is also secure. So when we think of data, privacy is part of it, but security is also the other part of it. So, and both are critical. And actually, our co-founder, as I mentioned, is a professor at UC Berkeley, and Anthony's research was partly on genomics, but also partly on cybersecurity. So he runs the largest cybersecurity testbed in the world to create the technologies that defend against cyber attacks and that sort of thing. And so security is kind of baked into our DNA, so to speak. But on the privacy side, there's some de-identification that can be done before data is shared for research. ALS TDI has a similar process as it stands with the data that's collected via questionnaires and samples through ARC. All the data is de-identified before research can be done on it. And on top of that, there's also contractual obligations that we extend to anybody who's making use of the data. They're obligated by contract not to even attempt to identify any of the participants if they're using de-identified data. In the case of ALS TDI's ARC study, the data is being shared with ALS TDI in its raw form, and ALS TDI is the one who's managing the privacy of it. And if participants choose to share the data with Unite for anonymous research, that's possible, and we'll de-identify it as well. But for the purpose of the ARC study, it happens all the same as it happens with the existing ARC data right now.
Got it. And how do you hope ALS TDI and also the other researchers who could be accessing this through the ARC data commons will be able to benefit from having access to this data?
Great question. One of the things that we've seen firsthand on the research side limit the speed of progress in terms of developing new therapies is the quality of the data that you're using to run your analyses. So you can think of it like, if you have a very unclear and vague outcome that you're trying to analyze, you can imagine it's not nearly as effective as looking at very precise, clean data that can describe a health outcome. And that ultimately determines not only the quality of the science, but also how many participants you need in order to reach statistical significance on any particular finding. And so by being able to share in data from electronic health records, the quality of the data, the precision of the data goes way up, the breadth of the data goes way up, and the depth in terms of like how far back in history goes way up. So now researchers can look at what are some of the patterns we're seeing prior to a diagnosis of ALS, or what are some of the patterns early in a course of ALS that are predictive of different speeds of progression, so that we can start to develop either treatments or even techniques to address some of those early on, maybe even prevent it if we can identify environmental things that are causing or influencing the genetics of ALS to ultimately cause ALS. All of that you can do when you have this very rich data as part of the study. You can't do that today with the data that's possible just through questionnaires and surveys. So it really kind of opens up a whole new world in terms of what research can be done, what questions you can ask of the data that's being collected, and ultimately what treatments might be discovered through that process. The other thing I'll mention is that our background is more on the data analysis, AI side of things. That's where we first started when we started Unite, was we wanted to apply these complex analytical approaches to the world of health data to unlock some of these medical insights. The way that we're looking at it now is applying those same approaches to make it really easy for the research community to uncover insights in the medical data. So, right now, a lot of groups may not have a data science team that can iterate over many different analyses of the data. And so it really slows down science. They can only ask a few questions per month, for example, of the data because it takes so long to analyze it. We're looking now at ways that we can make it much easier to ask questions of the data and get answers that move the research forward without needing a big data science team to make that happen. And we're excited to explore that with ALS TDI as well.
Awesome. Well, that pretty much brings us to the end of my questions. Is there anything else you'd like to add?
The only thing I'd add is an expression of gratitude here, which is, none of this can happen without the participation of the community, both on the research side, but especially on the community of those living with ALS and their the whole village that supports them, their caregivers, their family, the network of healthcare professionals they may be interacting with. It's not. We all know this all too well, that it's certainly not a disease that only impacts the individual. It is it's a meteor that has a very large impact on the rest of the family and friends and network and our communities at large. So the fact that they come week over week, take their time to participate in research and advance the research frontier for themselves and for each other and for future ALS community members is just amazing. I think in ALS we see the very best that humanity has to offer, and this is just a perfect example of that.
Great. Well, thanks so much for taking the time to talk to us today. And look forward to seeing where this collaboration goes. So thanks a lot, Tanner.
Thank you.
There are currently no treatments to stop or reverse ALS, but the ALS Therapy Development Institute is working to change that. To learn more about ALS TDI and our research to end ALS, visit als.net. Thanks for listening.